Can you imagine this? You are healthy on one fine day, but battling a severe enemy that draws huge amounts of water out of the body. Cholera is an acute but treatable illness that is caused by bacteria. It originates from contaminated water sources and shows no mercy to its victims. It is accompanied by diarrhea and dehydration. It mostly prevails in areas with poor sanitation systems and has been haunting humans for years. Let's move on and figure out how this devious predator spreads and how it manages to cause extreme loss of fluids from the body. What is cholera? Cholera is a sudden diarrheal infection that is characterized by extreme depletion of fluids and salts from the body. Heavy loss of fluids causes electrolyte imbalance that eventually leads to hypovolemic shock and death. It is an acute infection of the gastrointestinal tract. However, it goes away in a few days with proper care and treatment. Cholera affects millions of people worldwide, particularly in less developed countries with no proper sewage system. Cholera is more common in South America, Asia, Africa, and some parts of the Middle East. America and other modernized countries usually have no outbreaks of cholera. About 4 million cholera cases occur worldwide, and 140,000 deaths are reported in underdeveloped and developing countries. What causes cholera? Cholera is caused by a specific bacterium known as Vibrio cholerae. Vibrio cholerae belongs to the family Vibrionaceae, mainly inhabiting salty and fresh water. This acute diarrheal infection occurs when a person ingests this bacterium through contaminated food or water. Vibrio cholerae also lives in the natural water sources. Consuming such food or water containing Vibrio cholerae can easily cause the infection. Vibrio cholerae is a comma-shaped bacterium that usually prevails in developing countries with poor sanitation systems. More than 200 serotypes of Vibrio cholerae have been identified, but only 2 have been documented to infect humans. Also called the Bengal serotypes, the O1 and O139 are those 2 serotypes that are known to cause cholera in humans. Robert Koch first identified Vibrio cholerae as the causative agent of cholera in 1884. Vibrio cholerae produces a particular toxin known as cholera toxin, abbreviated as CT or CTX, which is the real culprit behind the causation of infection leading to excessive loss of fluids. Sambhu Nath Dey was an Indian scientist who first identified cholera toxin as the reason for cholera in 1959. The infectious dose of cholera is 100 million bacteria. An infectious dose means ingesting 100 million bacteria needed to cause cholera in a healthy adult. Who is more susceptible to this infection? Any person in contact with food or water contaminated with Vibrio cholerae can get this infection. However, children about 2 to 4 years old are more vulnerable to this infection. Individuals whose immune system is compromised due to any medical condition such as AIDS or diabetes, and even malnourished children are also reported to have a higher rate of infection. People with type O blood group are also found susceptible to cholera. How does the transmission of Vibrio cholerae occur? Vibrio cholerae follows the fecal-oral route for its transmission. It means it mainly transmits from person to person through food and water contaminated with the feces of an infected person. An infected person's fecal matter can contaminate food and water. However, Vibrio cholerae can also be found in freshwater sources. It sticks to the shells of crabs, shrimps, and shellfish. Discharge of diarrheal stool into nearby water resources like groundwater or drinking water supplies is the transmission source for Vibrio cholerae. Consuming undercooked or raw food, such as vegetables, fruits, fish, or other seafood, washed by contaminated water, also causes cholera infection. Drinking water containing this dangerous bacterium can also cause disease, leading to the heavy loss of fluids in the body. Food is the most common transmission source in developed countries, but developing countries have outbreaks due to the consumption of unclean water. Cholera infection is not contagious, but it can spread from person to person by touching each other directly after using toilets. What is the mechanism followed by Vibrio cholera to cause cholera infection? Cholera is a waterborne disease. Whenever a person ingests food or water containing Vibrio cholera, it transfers to the small intestine by resisting the stomach's acidic conditions. Our small intestine is responsible for water reabsorption back into our body. When bacteria reach the small intestine, it produces an enterotoxin, the CT or CTX. This CT toxin binds with intestinal cells, and a specific part of the CT toxin enters the intestinal cells and stimulates CAMP. This CAMP controls the movement of water, salts, and electrolytes from the small intestine to the circulatory system. CT toxin increases the activity of that CAMP, eventually leading to an increased flow of water, sodium, potassium, and bicarbonates into the intestinal tract, resulting in severe dehydration. What are the symptoms of cholera? Cholera is called blue death, as an infected person's skin appears bluish-gray because many fluids are lost. Sometimes, cholera can be mild, but it is mostly severe, and symptoms are likely to develop after 12 hours to 5 days after the bacteria is ingested. The main symptoms include watery diarrhea, along with vomiting, consisting of clear fluid. The watery stool, or diarrhea, is called rice water and is characterized by a fishy odor. Other symptoms include extreme thirst, less urination, sunken eyes, and xerostomia, which means dry mouth due to dehydration. Loss of electrolytes results in muscle pain. Lethargy, weakness, and irritability are also the other symptoms that are associated with cholera. When electrolytes, sodium, potassium, and other bicarbonates are heavily lost in diarrheal fluid, it leads to many conditions like faster heartbeat, muscle cramps, hypertension, and hypokalemia, which means low potassium levels in the blood. Severe dehydration causes wrinkled and stretched skin. If these conditions are left untreated, then the consequences will be kidney failure, shock, coma, and death. What are the methods to diagnose cholera? The healthcare provider asks the patient to collect his stool sample in a plastic sterilized bag or bottle. Then, this sample was analyzed under a microscope to look for the presence of Vibrio cholera. The dipstick test is also a diagnostic method in areas with more prevalent cholera. In this method, a specially designed test strip is dipped in a stool sample. If the patient is positive for cholera, then 2 red lines will appear on the test strip, and if there is another reason, only 1 line will appear. What is the recommended treatment for cholera? Cholera usually lasts for 2 weeks. However, immediate treatment can save a person's life and decrease mortality rates. It is essential to replace the lost fluids through an ORS solution. ORS stands for oral rehydration salts. ORS is a solution that consists of measured quantities of glucose, sodium chloride, potassium chloride, and trisodium citrate. This solution maintains the fluid volume in the body. Intravenous fluids are also given in case of severe dehydration. Antibiotics are also administered to mitigate the symptoms of cholera by directly targeting the bacteria. Prevention of cholera. Do not eat raw or undercooked meat or seafood. Use boiled water for drinking purposes. Always consume freshly cooked foods and vegetables. Using chlorine for disinfection of water is also an excellent preventive measure. Always wash your hands before eating and after using the toilets. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.